Hi, everyone. Welcome. I hope you can hear me. Hi, Matt. How's it going?
Going well. How about yourself?
Good. I don't know if Will is on, but we'll give everybody one more minute and then we'll get started. Hi, Serena. Oh, this is so great. So we're gonna be doing a very climate heavy talk today, but we have some great presentations lined up for everybody. I think in the interest of time, we're recording this, so we'll just go ahead and get started. And like I said, just up front, I'm going to do a very quick COVID review, just to give everyone an update on the COVID developments from the health department. But then we're actually going to spend quite a lot of time talking about climate health and climate change and its effects. So let me share my screen and I will just go through and show everyone the projections. So this is basically our projection in Fresno County. Hopefully you can see this on the CalCat website. So today for Fresno County, we have currently around 380 patients in our hospitals. The projection looks like it's actually kind of rosy, going into October. And hopefully this downward trend, which is being predicted, will continue. It's hard to tell how they got that downward trend, given that this is basically a plateau that we've been experiencing since August. But I'll try to explain why they project a downward trend going into the first few weeks of October. In terms of the ICU, same downward trend again. And then in terms of the death rates, again, sadly, we are going to continue to see a rise in the number of fatalities, but it looks like it may be on the lower end than the higher end. So I guess that's the silver lining there. Why are they saying that there may be a downward trend? It's because we finally dropped down below 1 on the R effective. So you'll remember that we talked about the R effective. We break it out across regions, and in our region, which is Central California, the R effective being 0.8. means that basically the transmission is slowly dying out, and hopefully we will be able to put the brakes on further spread, because that's kind of how the R effective works. When you look at this data as a whole, the R effective is actually even lower. It's 0.7, which is kind of why the national headlines you've seen and the state headlines are saying that, you know what, California now has COVID under control, blah, blah, blah. And while, we are still very impacted locally, we really do feel that as a region, we are going to improve. We may be a little bit behind some of the coastal regions, like, for example, the Bay Area. You can see the R effective is in the 0.7 range. The rest of the other regions kind of hover in the 0.7. Northern California is still struggling like we are here in the Central Valley. They're in the high 0.8s. And so that's basically why the different regions are doing a little bit differently. But overall, as a state, with the R effective being less than 1, that's why the projections are looking pretty good for the rest of this month and early October. The other big news which came out, I think earlier today, is that California followed the signal from the FDA, and effective immediately is what the California CDPH is saying. They basically have approved the Pfizer booster for these age groups: 65 and older, underlying health conditions, high-risk jobs, healthcare workers, teachers, and daycare staff, as well as, the essential workers. Basically, there's a long list of essential workers, but in general, it's people that work in the public service or on the front lines of public service, such as grocery workers, people who operate homeless shelters, those who are working in the prisons and other congregate settings. So that's basically live now. I feel for those of you that have access to Pfizer shots, you can go ahead and start giving those boosters at the 6-month mark since their last shot. We've heard from you about Moderna, and so we're still waiting to hear the official signal to go ahead and advertise that you are doing Moderna boosters. If you happen to have Moderna because you're halfway through a vial, and the rest of the vial is going to get thrown away, please don't throw that away. Please, you can go ahead and start with the boosters on Moderna, but you shouldn't open a new vial or advertise that you're doing it but if it was otherwise going to waste, to just be consistent with the same message that we've given ever since the start of our vaccination campaign, you can go ahead and start doing Moderna boosters as well if you're working with Moderna. With Johnson & Johnson, I honestly wish I had better information because I haven't even seen the antibody studies. Moderna actually has published their antibody results, which makes us believe that, it's going to do the same thing as Pfizer, is going to get the approval. With Johnson & Johnson, I haven't had a chance to review the antibody data. And so people are still being asked to hold on. I know that that's really hard. And fortunately, it's a very small number of people, but we understand that those people may be concerned or anxious. Please reach out to us and we'll try to formulate a plan that makes sense about how we can keep them protected and maybe get them another kind of vaccine. There's a lot of different ways to answer that need. And I don't know that anything makes more sense than another approach, but we'll certainly work with you to help craft something that makes sense. So those are really all of my COVID updates. I guess the last COVID update is that monoclonal antibodies are really coming into our county. And we're doing actually a pretty good job. So thank you for those of you who are doing the monoclonal antibodies. We really appreciate it. As you know, with the national shortage, they are asking all of the monoclonal antibody providers to work through the Mohawk system. But it just so happens that our allocation is going up week by week. Maybe because allocations in other parts of the state are going down. We don't know exactly what it is. Maybe there's manufacturing supply that has been unlocked. But either way, we basically have hundreds of doses of monoclonal antibodies that we're actually not using and that we're actually declining from the state. So if you are in a position where you can provide monoclonal antibodies or you need some, please reach out to us. Because we just this morning told the state, that they can give 100 doses of monoclonal antibodies to another county. I don't know. I just wish that we could use all of the allocation that's given to us, but we need your partnership to do that. So please work with us if you have patients or if you have a need to get a hold of the monoclonal antibody supply. Hopefully someday soon, the manufacturing will be up at a level where you can just directly order from the manufacturer or from the AmerisourceBergen vendor. But right now they want you to work with the health department and we're happy to advocate for you and get you some supplies. And so just FYI on that. And obviously, if you have patients or staff that need monoclonals, our advisory from September 8th is really good. We're actually updating it again because this is changing so quickly. So if you need some pointers about where you can send people to get monoclonal antibodies, let us know that as well if it's not evident from your review of our website. Any questions about COVID related stuff? Okay, let me switch gears now and dedicate the rest of this hour to climate health. This is something, again, I've talked about it before, and I'm going to give you a little bit deeper dive and share some new announcements and updates about climate change. I see Chris has a question or a comment. Do you want to unmute yourself, Chris, or do you want me to read it?
Hi, Dr. Vohra. Can you hear me?
Yes.
Oh, sorry. I just posted a question. If maybe I missed this, if someone had the 2 Moderna shots and they're over 65, should they get the Pfizer booster or wait for a Moderna booster?
There's no wrong answer here. The US really wants people to stay in one lane and just stick to the brand that they got before. Other countries are more flexible and are allowing a mix and match. I saw a headline that, the Oracle of Fauci is actually okay with that as well, because mechanistically it makes sense that, you would basically be able to capitalize on the immune response to the spike protein because both of those are spike protein RNA products, and that basically the 3rd dose of a Moderna would help augment the immune response that you started with Pfizer and vice versa. So to me, I don't think there's a wrong answer. I don't think that it's a terrible idea to get a Pfizer as the 3rd dose if you had 2 doses of Moderna. Then again, like I said, there are people that actually have leftover Moderna doses. So if a Moderna patient wanted that booster, they could probably find a clinic that could just call them if they have any leftover Moderna doses that they can basically get that patient. It would be an on-call basis. It could be something kind of prearranged or scheduled. I don't think that that's something that we can sanction right now. But like I said, there's no wrong answer. And I think that that's reasonable if they either wanted to switch brands or stick with the same brand.
So the booster then is not qualitatively different from the original Pfizer vaccine?
No, it's the same dose.
Okay. All right. Thanks, Dr. Vohra.
Yeah. Any other questions? All righty, I'm going to share my screen again, and this time walk you through this PowerPoint that is really hopefully going to give you some things to think about that are new, but hopefully not too new and hopefully not too grim. This is kind of a topic which does invite apocalyptic thinking, but obviously we don't want to paralyze people with the doomsday scenarios. So I'm really just going to run through what I think are the facts that we all need to know as healthcare providers, the public health import of climate change, and then basically the opportunities that we have right here in Fresno County to make some real to make some real effective steps in the right direction. So that's my kind of goal for this section. I'm going to be talking for about 25 minutes, and then actually I've invited a couple of our emergency medicine residents who are rotating with me on the Poison Center rotation. And just like last month when we had some presentations from our emergency medicine residents, we've got Dr. Matt Lippy and Dr. Will Fry today, who are actually going to do a deeper dive into a really cool aspect of climate change. But let's get to them in a little bit after I've done this introductory section. In terms of key points, we're living through an era of intensifying effects of climate change. And I really feel like that the residents of the Central Valley are the canaries in the coal mine, that we have a very vulnerable population and that we are exposed to detrimental effects really on a number of different fronts with heat, drought, wildfire smoke. All of those things are going to be impacted and exacerbated by climate change. Central Valley communities that already experience health disparities are going to be even more vulnerable than their counterparts. And as clinicians, I really feel like this is our professional responsibility and really even our moral duty to respond to these trends by first of all teaching ourselves, because if you're like me, you're really on the learning curve here, and also teaching our staff and our patients about this concept of climate resilience, because this is something that we're all going to need to really build up as a skill set moving forward. All right, so just to get really back to basics, and it's totally fine if you're just not even aware of this because I wasn't, which is that, this whole concept of greenhouse gas and what that means. So basically, whenever fossil fuels are burned and other sort of industrial off-gassing occurs, you really release a lot of molecules of carbon dioxide or even water vapor, methane, and nitrous oxide. And those basically form a layer in the atmosphere, which creates a greenhouse effect. And that basically, instead of allowing energy to get bounced back into space, it just traps that energy. And that energy basically gets converted into heat. And that's what they mean by global warming. I really think about this through the lens of addiction because I am a toxicologist. And, it's sad to say, but we're hooked, whether it's the cars that we drive or the food that we choose to eat, or the way that we do all of our manufacturing and building, really so many small and large choices that we've made as a society now coming back to really to catch us. Eventually addiction may feel good for a while, but it eventually does charge a price. And I really feel like, insofar as our whole society is addicted to fossil fuels, this is really a story of addiction as much as it is a story of global poisoning with carbon. So in terms of why this is bad, the IPCC Intergovernment Panel on Climate Change has said, really, we have a choice to make about, how warm we allow this planet to get. And these are just degrees, these are not huge numbers in and of themselves, but if this planet exceeds 2 degrees of warming during this century, that's already going to spell catastrophe. And the way that things are going, it's probably going to be between 4 and 8 degrees. So the reason I bring that to your attention is that if you didn't know the implications of those very small differences, you could think, well, who cares? 1 degree, 2 degree, 8 degrees, big deal. Well, these are really big deals because they have such big impacts on the balance of the ecosystems that we're talking about, and really the litany of damage that is already being observed, whether it's glacial retreat, hot weather, sea level rising, the Arctic ice, polar caps, or ocean acidification and poisoning. All of these are basically just off the charts, and it's happened in a very short time. Whether this is a major or a catastrophic consequence is really up to the choices that we all make as a society. I mean, I know that that's a very vague term, and it's so vague as to be almost useless, but I think it really is what the scientific consensus is at this time, which is, we can let this be a very small impact, or we can ignore it, and then it's going to become a huge impact later. And so that's really the choice that we have. This is a slide that I've shared before. This is a great paper from New England Journal, which continues to publish really good research about the health effects of climate change. And this really connects the dots, is, you get increased carbon dioxide and other pollutants in the climate, which then create the greenhouse gas effect and rising temperature. At the same time, you have rising sea levels because of changes in glacial ice, for example, and also just extreme weather events. Whenever those are rarefacted through the lens of, how strong are our warning systems? What is the population's socioeconomic status and health and nutritional status, so-called underlying social determinants of health, then you basically have greater or smaller exposure pathways that then create health effects. So these exposure pathways include extreme weather, heat stress, air quality, water quality, food supply, vectors and insect species that then get broadly distributed, and then just social and mental health factors. Again, you've seen this slide. I don't want to belabor all of the bad things that could happen, but it is kind of interesting that for any single one of these exposure pathways, there are real world complications that are not in the future. They're happening now. We are seeing heat related illness. We are seeing cardiovascular and respiratory morbidity and mortality. We are seeing, different kinds of infections, and what we're going to talk about in a little while, which is harmful algal blooms as a result of climate effects around the world. And all of these could play a role here in Fresno County and in Central California. So that's why it's important to know there's kind of direct relationships, and then there's kind of more indirect relationships. The direct relationships include extreme events related to temperature, waterborne diseases and vector-borne diseases, air quality, which all of us are living through right now if you just look out the window, and then foodborne and food security issues. So food production as a major agricultural area, which is also experiencing a pretty substantial drought. I think this really brings the issue home, is that this is actually going to affect so many dimensions of what life is going to be like here in the Central Valley that it's hard to ignore. Biodiversity, infrastructure issues, and then a lot of the social disruptions related to dislocation and migrations, mental health impacts, even addiction to substance use, and then community and social activity impacts will all be disrupted. What does climate change really mean? I think these are the 4 big kind of domains. At least the grant that we've applied for is really going to focus on these 4 domains. And I'll explain more about what that project is, because that's one of the projects that I'm really excited to embark on. But basically, these should not be new to anyone on this call, is that all of these are things that we do talk about and that we do try to need to prepare for. But I think the overarching climate resilience concept is something that we can be leaning into a little bit more. I like this quote from William Gibson, who's actually a sci-fi writer. He says, "The future is already here. It's just not evenly distributed." Because I really feel like this is what's happening with climate change, is that it's already arrived. I think one of the mythologies of climate skepticism and climate denial is that it's going to happen far off in the future, or it's going to happen far away, and it's only going to affect polar bears at the North Pole. And those are both absolutely false. Actually, this is actually happening to people that we know and live right next door to in many ways, because it's happening right here in California. Another word for global warming is global weirding, because things get so unpredictable so quickly. And this has to do with, I think, complex adaptive systems and kind of what happens when very small changes lead to very big outcomes. But basically, I like this graph because it's a projection of just how crazy the temperature extremes are going to get. And then basically, year by year, you're going to have hotter and hotter days, so that we can just expect that, that will have implications to all of the people that have to work outdoors, the way food is grown, the way that shipping and transportation is done, the way that we try to keep our houses cool. All of these things are going to be affected by the fact that there's going to be more and more hotter days in the decades to come. Same thing with areas burned in wildfires. So again, unfortunately, people say that we shouldn't even talk about wildfire season because it's a year-round hazard at this point. But the amount of heat, which then dries out the fuel that's up in the forests, these things are projected to get worse. And depending on whether, again, the RCP 4.5 versus 8.5, those are the degrees of change that I'm talking about. Is, if the Earth warms by 4.5 degrees versus 8.5 degrees, you're going to have a differential impact. Either way, even if it warms only a little bit, you're still going to have increased wildfire acreage. It's just how bad it gets really depends on how warm the world gets. Just to remind everyone of the Creek Fire, I think it's hard to forget just what a massive fire that was. It looked like an atom bomb went off in Shaver Lake. This was actually taken from a plane that was just flying overhead over Labor Day. And this is what the geographic area was like. And it lasted from Labor Day all the way to Christmas Eve. So just how massive that fire was and how long it took to actually control. This was the worst disaster in Fresno County. There were a lot of reasons why it happened in combination: dead trees, dry wood, gusty winds, and then the very, very dry conditions basically created this just perfect storm that people are still studying and will continue to study. I won't belabor the rest of this slide. I think we've talked about this before when we had our presentation from the EPA. But basically, this is something that unfortunately was not a one-off event. We have fires now that are, in the same Sierra foothills and affecting our national parks. And so again, we're breathing bad air. Here's what actually the air quality does. So whenever you have fires, whether it's the lightning complex fires that were a little bit north, the Creek Fire, which was around Shaver Lake, basically the air quality, the particulate matter 2.5 concentrations just start to spike, and then they stay high above the air quality standards, which by the way have been lowered by the WHO just this week. But nonetheless, this was the higher standard from last year. You get these spikes, and then just, the air quality remains suboptimal, to say the least, for many weeks to months after a massive fire like that. And whenever the air quality is bad, that affects people with asthma, that affects people with cardiovascular disease. There's thought to be some inflammatory cascades that can create neurological conditions like strokes and things like that. So there's a lot of kind of fallout that's still being studied by the EPA and other agencies about exactly what particulate matter does. And then when you look at the pictures, this is heartbreaking to look at from the human perspective, but this is not just simple carbon in the air. This particulate matter contains heavy metals and chemicals and all kinds of other stuff that may combine to cause health hazards that we're still trying to figure out. You might have seen, it's probably, it's probably going to be just a kind of a symbol of where we are, but you've probably seen these trees that are now wrapped in aluminum foil because they're trying to protect them from the fires that are going on with the KMP complex. And I just think, wow, how much more do we have to wrap in aluminum foil before it's all said and done? Are we going to start wrapping cars and playgrounds in aluminum foil to try to protect them from fire? But anyway, this is just heartbreaking to look at on so many levels. But again, I don't want this to be a doom and gloom lecture. This doesn't have to be the whole story. There are things we can do to protect our communities. And that's really why I'm sharing this lecture today, is because I really want to inspire all of us to work together, because I really feel that within this crisis, there's an opportunity, and really we need to lean in and lead here in Central California on issues related to climate health. So what can we actually do? Well, educating our medical providers I actually gave a version of this talk to the Fresno Madera Medical Society, and I'm so glad that they've committed to partnering with the health department on issues related to climate health. And I'd like to recruit really as many of you as I can into this effort of, doing education, really doing connecting and really coaching all of our vulnerable communities on what to do. We can do trainings, we can do workshops, we can have town halls. We can really elevate the level of general knowledge around climate health, because I think it's going to require just everyone working together in the same way that we did with COVID to really find solutions that make sense and that actually will be adopted by the people that need them most. And we need to listen to our communities and really hear them about what their needs are and how we can work with them. And the only way that we do that is by actually connecting at a deep level. Collecting data, obviously very important, something that we at Public Health are very interested in, but we can't do it without you. I mean, so much of the clinical data from encounters to just mortality and morbidity trends will come from all of our local clinicians. So we need to figure out structures how we can share information so that we can all learn from what's going on in real time. In the same way that we're sharing information about COVID, it's not perfect, but imagine trying to fly blind instead of knowing exactly what's going on with all of our COVID cases, so we can make projections and modeling and prepare for the future. That's exactly what we need to be doing with climate-related data points as well. Just advocating at the state and federal level. So, I think the governor today is going to sign a big climate bill. He's actually visiting the wildfires from what I heard. And then at the federal level, there's actually an infrastructure bill that's making its way through Congress. Whether that bill or bills to come will be what's required to help sustain this work. We just need to elevate this and say this needs to be a priority, because we can't afford to wait, and we really need to invest in robust and workable solutions to help with climate health. So I meant to say decarbonize, not decarbonize, but basically, let me talk a little bit about decarbonizing healthcare, because this really was really eye-opening, and I just wanted to share this information because I think these are kind of more immediate steps and low-hanging fruit that we can be taking in healthcare. I think I've gone through all of this, that basically this is happening already. These are affecting our community. It turns out that the HHS in late August, this didn't make very much news at all, but I thought this was quite significant. The HHS actually started an office of climate health and equity, and they're going to start looking at this in a more formal way. So I am hoping that actually grows, as it needs to very quickly, and gets built up to be a more robust division of HHS. And I think it just goes to show you that this is getting a lot of people's attention, and that they are expecting all hands on deck for every community that's going to be affected. And ours certainly is, even more than other California communities, that we all need to kind of work together and learn from each other when it comes to climate health. So you've heard me talk about this concept of C6. I really see this as a catalyst to help unite really everyone: public health departments, regional and local governments, academic medicine, clinicians in the community, community-based organizations, climate health researchers and other institutes, the air boards and the water boards, environmental justice leagues and other organizations, and then even law enforcement, schools, business leaders. Really the same model that we have for COVID, where we really just took a multilateral, multi-agency approach. I really think that that's what climate is going to require. And right now we're calling it C6, Central California Climate Change Clinical Collaboration. So hopefully, if this is something that you're interested in, you can help partner with us. We know that no agency can do this by itself. I will humbly submit that the public health certainly is not going to be able to do this lift independently. So we all need to work together and teach each other. And I really think that that's the way forward. In terms of what is FUERTE, I'll talk about that in the next slide. This is actually a 2-year countywide health impact assessment. We proposed a grant. We'll find out if we get this grant or not. It's a relatively small grant, but it's basically just starting the work of mapping out what we need to know in terms of estimating the current distribution of climate-sensitive diseases. People have done some of this, but it was in the pre-COVID era. And I think that we really need to take an equity lens and really learn about what worked and what didn't in terms of reaching people and communicating with them. So I think it's important to do this health impact assessment and at the same time build a network for education and advocacy at the same time, so that when we talk to people in these neighborhoods with these community-based organizations, at the same time, we're also starting the work of training them to be resilient. The name is called Fresno Understands Environmental Resilience Through Equity, or FUERTE. So this is going to be the FUERTE project. And like I said, I'm really excited. We've got emergency medicine residents that are interested, even medical students and academic clinicians who are interested in helping with this, along with the Public Health Institute and the Environmental Justice Network. So we're really hoping that this comes to fruition as a way for us to just start down the road of understanding what it will take to make our community more environmentally resilient. All right, so here is kind of a very surprising article that just came out on the 1st of September, and this is about reducing the emergency department's footprint. I was astounded to learn that healthcare in general and emergency departments specifically are actually kind of big offenders when it comes to greenhouse gas production. So basically, if healthcare was a country, it would be the 5th largest producer of greenhouse gases in the world, behind the other big countries that we know are big offenders, like the United States, and other countries. So healthcare would be like number 5. It would be at the top of the list. Did you know that 1/5 of all patient food goes to waste? It's certainly something that I've seen in many different hospitals that I've worked at, but it's probably a universal phenomenon. The ED, this paper, which was just published, shows that the ED generates an average of 2 kilograms of garbage per patient encounter. So this is a massive carbon footprint due to waste disposal practices, the way that we use and manufacture metals that eventually get into the supply chain, criteria pollutants, which we will talk about criteria pollutants during a different lecture, but that's a very technical toxicology term about a list of chemicals that are considered just super duper environmentally objectionable, and other toxins. So I just wanted to bring this to everyone's attention, that there's probably some low-hanging fruit about the way that we're doing what we're doing. And this is a harm reduction step. So obviously some pollution is inevitable. We have to do our work and deliver healthcare in a safe, sterile way. But there's an otherwise tremendous amount of waste in our healthcare system. This is a JAMA editorial, by the way. And reducing waste is not just a cost issue, but really it's a health issue when you say, is the way that we're operating our clinics and our hospitals actually contributing to the harm of our community instead of the health of our community when you look at the effects of global warming and greenhouse gas emissions. So it's kind of like different lens to look through the work that we do. But, I think it is a fair question. What can we all be doing to reduce wasted supplies, wasted food, and electricity? There's actually community-based and faith-based organizations in town that are doing nothing but helping redistribute food. So I would love to get them in partnership with our area clinics and hospitals so that they can actually help, this food that would otherwise go to waste, go to people who need it. There's probably many other solutions. And so I hope that we can expand that dialogue and say, what can we do to really, like I said, decarbonize or, lessen our carbon footprint. It's the right thing to do. And it's really something that you can expect questions. I can guarantee you. This is not a secret anymore. This is something that is out there. It wasn't hard for me to find this information. And unless you have good answers for, media and other inquirers that are going to ask what healthcare is doing to reduce its carbon footprint, you can bet that they are going to be asking these questions at every level, the federal level, the state and local level. So I just wanted to make you aware that that this is happening. Don't think of this as the hottest summer ever. Think of this as the coolest summer that we will ever have in the future. That's all I have for now. Let me actually, if there's no questions, then let me go to Matt and Will. So let me see if there's any chance for questions. Lance, as always, gives us his perspective. I really appreciate that, Lance. I definitely can't wait to read that link. Hopefully everyone else will click on it also. But yeah, there's so much to learn. I very humbly submit, like I'm so humbled by how much, I didn't get taught in medical school or even in toxicology training. And there's so many toxicology aspects of this, but that we all need to learn about. And I just hope that we can all kind of just have that very humble attitude and try to teach each other. Anyway, let me switch gears because we are coming up on the half hour, and I want to get these doctors to be able to do their presentations. So if you want, please put your comments in the chat or save them till the end, and then I will let Matt and Will, who are both emergency medicine residents in their second year, present on a very cool topic that I'm very excited to learn more about, and that is the toxic effects of algal overgrowth. So this is something that that we've been talking more about just in the context of climate change. But I think that there's actually more to the story than just simple temperature. So I don't know who wants to go first, but please take it away and feel free to share your screen if you want, Matt and Will.
I can go ahead and go first here. Let me get the screen share going. It's telling me that the screen share has failed to start.
Okay.
Let's see. Let me try this again.
Or do you want Will to go, or does it matter?
There we go. You see on my screen now?
Yeah.
Cool. So we're going to talk about two different flavors of algal overgrowth and that overlap with climate change and toxicology. And so I have chosen the marine variety, so the saltwater variety, and then from Will you'll be hearing about the freshwater variety. So all these cool little micrographs are from different types of dinoflagellates, and so that's the major culprit in these marine overgrowths, at least. And dinoflagellates are these really cool little single-celled eukaryotes, and most people are probably familiar with them from these pictures of the ocean glowing at nighttime, and it's this fun little catalytic oxidation reaction that happens when you have high levels of oxygen in the water, such as when a wave crashes. And then some enterprising person turned this into a little dinosaur that you can put on your desk and shake and make it glow. But mostly we're more concerned about these toxic algal blooms. And toxic algal blooms are not something that is new in the world. The indigenous folks in Americas knew not to eat shellfish during the summer months because it could make you quite ill. But they have become a little bit more frequent and certainly longer in duration over the last several decades. There's two different theories on why this might be. Most of it has to do with the increase in phosphorus containing fertilizers that run off into our oceans. And then you have a couple of different views on how the process happens. So do you have just an increase in nutrients, or is it an imbalance between the grazing zooplankton, which are little animals that eat these dinoflagellates, and then the photosynthetic variety that creates these toxins? So today we're going to talk about three different types of marine toxin syndromes. There are multiple others that are either not particularly relevant in the United States or just so rare that it's unlikely that you would ever see them. So first we're going to take a little trip to Orange County. Bonus points if you're able to identify what kind of animal this is, but this is a California rock scallop. So this gentleman had some difficulty breathing. He was alert and oriented, but then started to get extremely weak once he got into the emergency department. And this is the presentation of someone who has paralytic shellfish poisoning. This is something that's very rarely seen in the United States, but it's mostly because we have a shellfish quarantine and a very aggressive testing system within our commercial seafood infrastructure. These, like most of the marine toxins, are heat stable and do not break down when cooking. Traditionally, this was thought to be mostly a West Coast problem. This is just heat maps of cases over the last 2 decades. But if you take a look on the East Coast and in Florida, you actually start to see some cases cropping up once you kind of widen your lens a little bit. Next, we're going to take a little trip up to Humboldt. So it's after Thanksgiving weekend, and you get 4 people into the emergency department who all have a variety of rather unusual symptoms, from nausea and vomiting and bloody diarrhea to one who has some short-term memory loss. This seems to be a little bit more of the new kid on the scene. This is a presentation of domoic acid, which is also referred to as amnesic shellfish poisoning. Having grown up fishing for many years in California, I don't remember too many closures related to domoic acid, but they've now had a closure every year for the last 5 for some period of time during the Dungeness crab season. So it seems like this is either increasing in frequency or concentration, or maybe we're just a little bit more aware of it and are better at testing for it. But it's hard to say for sure. What is certain is that the number of intoxicated sea lions with this in California is definitely increasing. So while the human data isn't necessarily caught up, we are seeing a lot more animals at the marine mammal centers that are intoxicated with this and are dying because of it. And then last, we're going to take a trip over to the East Coast in Miami. This was a case report out of, I think, the General Hospital in Miami, where a crew on a sailboat had caught a couple barracuda, and they had baked the barracuda on their little in their little boat stove with a dime in its gills, and then they all became quite sick. Most of them, just like all the other symptoms, were nauseous and vomiting, but there was also a lot of respiratory distress and some kind of strange rashes. The more interesting presentation on this one was that one of the patients reported feeling very chilled, and then decided to go sit in front of the heater and felt like it was actually air conditioning that was blowing out of it rather than heat. And this hot-cold reversal is a pretty pathognomonic thing for the ciguatera toxin. Just like most of these other ones, these case reports are very rare. Most of the people who get this probably aren't presenting to care. And so the epidemiologic data on this is fairly terrible. And then this thing about the dime, this is one of those old fisherman's tales that if you put a dime in the gills and you bake it and it doesn't tarnish, the ciguatoxin isn't there. There's no validity on that. And having talked to a couple of people who have gotten ciguatera, I don't think any of them have ever successfully found a tarnished dime in the gills after cooking one of these fish. So that's just kind of a real crash course on some of the more relevant biotoxins that we have in the United States. Most states have their own public health run biotoxin hotline that kind of keeps track of the random monitoring data that's going on in the state. Most of them will update it on a weekly or bi-weekly basis. If you are someone who goes out and collects sport harvested mussels or clams, you probably already know this number. If you're just kind of curious, you can call this number. It's a pre-recorded line, and it'll give you a rundown of the local information on it. And that's about all I got for today.
That's awesome.
Let me see if I can end my screen share here.
Right. Looks like Will is up. Go ahead, Will.
Hey everybody, my name is Will Fry. I'm also a resident at CRMC in the emergency medicine program. Fresno native. I like it here a lot. I've survived the heat for most of my life here, but I'm gonna take another. So I'm trying to start the slideshow here. There we go, slideshow. So another approach to these algal blooms, I think the saltwater algal blooms and the associated poisonings are maybe a little bit more talked about, but something I really wasn't on my radar was the potential for freshwater algae blooms. And then again, you know, what we may be seeing in the future as we see the effects of climate change. Are you guys seeing my screen okay? Perfect. So, you know, a little bit bigger picture than Matt here. What we're dealing with are cyanobacteria. They're not actually bacteria. That's kind of a misnomer, but they're their own single-celled organism, and they're ubiquitous in saltwater, freshwater, and a really vital part of the food chain and kind of how our environment has run and held together. I don't know if many of you guys have maybe been to Millerton Lake or Pine Flat Lake, and something you may notice is that in the winter, the water is pretty clear, whereas in the summer, it has a kind of a more greenish, cloudy look to it. And so what you're seeing is that these phytoplankton are more numerous and dense when that water is warmer and a little more stagnant. And so we'll kind of get into that, but that's just a big picture look at kind of what we may see happen. So these algae really don't cause us a lot of problems until we have a bloom. And a bloom you can kind of think of as the conditions were just perfect, and it went from you know, kind of cloudy water to these really thick, even matte, you know, kind of situations where you look and the surface of the water is just covered, or you know, the surface of the water or the water itself changes a really brilliant color. And in freshwater, the major kind of, it's not really a species because it encompasses a group of species, but we're looking at blue-green algae, and so they have a bluish or greenish tint when they do form a bloom. And so, you know, not all of these blooms, if you see like a pond or something and it's got that scum on the top, not all of them are toxic, but it's interesting that actually, you know, somewhere between 1/4 and 3/4 of these blooms do have some toxic component. And it's not uniform what toxin exists. It's really interesting. There are I don't know, maybe even dozens or hundreds of various forms of toxin that can cause a wide variety of effects. And kind of like Matt was talking about in some of those cases, you get things, you know, as benign as a skin rash, which actually personally I experienced as a kid here in Fresno County. Went swimming in a pond, which seemed like a great idea in my teenage, you know, mind. And I got this like terrible itchy rash. And you know, it was like clearly from the water, but you know, probably from some of that dermatotoxin. And so then on the, you know, maybe more mild but still concerning spectrum, you can get nausea, vomiting, diarrhea, kind of GI symptoms. That'd be more from an ingestion typically, but also even aerosolization can occur from these. And then on the severe end, there are neurotoxins and hepatotoxins, which potentially could lead to death. So yeah, you can just contact an algal bloom and get some of these effects. Drinking it may be more likely to affect your dog if you're out on a hike or something, but also potentially a problem. Our drinking water, if it does come from lakes, is typically treated and kind of screened for these things, but you know, that is kind of a separate issue there. So one of my questions to myself was, how big of a problem is this? I've really never encountered this aside from myself swimming in a pond. I haven't encountered it in a clinical situation, but you know, some different studies have looked at epidemiology, and in just a couple-year period, they found about 300 cases that had made it to the emergency department. And so obviously that's just a small sliver of what's out there and what happens. But I thought that was pretty interesting. And there kind of went into the different, you know, scenarios and the different effects that were experienced, but primarily skin, GI, and then some neurologic, you know, respiratory neurologic problems as well. So what does climate change have to do with this? There are a couple reasons that climate change may make this a larger public health problem. First off, just warmer water temperatures. Not only does that favor the growth of these algae, but it favors the ones that produce toxin. And then when you have warmer water temperatures for, physics reasons that I probably don't fully understand and won't get into, that warm water is typically more stagnant, and less flowing water promotes that algae to grow. And then what happens is once this bloom starts happening, it's a little bit of a, it encourages the growth of more. They absorb sunlight, it gets warmer, it gets more stagnant, and so you have this compounding effect. Another part of this, we hear a lot about the saltwater blooms, and actually our freshwater will become more salty as it kind of evaporates and gets more concentrated. So drought leads to saltier freshwater. And then in some areas, less so in California, but like Texas and Florida would be a good example. Some of these brackish areas will become more salty as as sea levels rise and as drought kind of takes effect on some of these freshwater places. And so we may see more of the marine algae species in our freshwater. Some other factors that are going to promote this, the more CO2 we have in our atmosphere, it equilibrates with the water, and this is essentially food for the cyanobacteria and promotes their growth. And then, what we're seeing in addition to drought are periods of more intense rainfall. And so it's like a long drought and then intense rain. And those periods of intense rainfall that create these kind of temporary pools and, wash a lot of things into the water, fertilizers, other things like that, that creates a perfect environment for these blooms to occur. So, kind of some conclusions I came across and came to my own understanding when looking into this. I wouldn't say freshwater algae blooms are currently a large public health problem. I think in the scope of COVID and wildfires, there are larger fish to fry. But this may become something that's more on the public radar and something that we see more of. Kind of remains to be seen, but it could be predicted that this may be a large problem. That being said, we have numerous avenues to mitigate the effects of this. They're already in place. UV treatments, chemicals, chlorination. Chlorinate your pool to prevent algae from growing. All these things cost money and are adding to the kind of cost of climate change. And most of these interventions are harmful to the other flora and fauna in the water. To get rid of the algae in, like a pond that you have in your backyard, you may be killing all of your fish. And that's kind of a small example, but just, none of these things are acting in isolation. And, all these mitigating efforts are really just reactionary to something that's already occurred. And in terms of prevention, that's a little bit more difficult. We've done things with agricultural practices to mitigate this, but there's really a lot done in that spectrum already. And there's climate change, I think, is going to be a difficult to mitigate factor. So maybe some new technology will evolve as this potentially becomes a larger public health problem. But it's interesting. It's interesting to think that you could go on a hike and jump in the lake to cool off and have some problems from that, or your dog may run off and drink out of the pond and could get sick and die from that. And so it's really not something that was on my radar, but it's interesting, and we'll see kind of what plays out with this. That's all I have. Thank you.
Thanks, Will. That was fantastic. Both Matt and Will did such a great job. We're open for commentary if anyone has questions or contributions. I have a couple of comments, but I actually want to call on Dr. Serena Huntington, who is my partner and colleague at the Poison Control Center. Serena is the managing director at Poison Control. And we're actually embarking on a collaboration with the State Department of Public Health. Do you want to talk about how poison control fits into this story and really expand on Will's comments about how we can start tracking this closer?
Sure. So at the Poison Center, we receive a ton of these calls from just the general public who are out walking. They see these posted signs about not going to the water because of these harmful algal blooms, or they come back and they have symptoms. And so in our partnership with the California Department of Health, we are sharing some of that information of where these, where we get reports from this. And so I'm going to share a link in the website that actually our pharmacists use to help not only track it, but we also have our cases going into the Department of Public Health so that it adds to this tracking system. And I found this website really, really useful when patients call us and ask, we saw this green water and now I'm very itchy. How do I know if I've been exposed to these harmful algal blooms? And so this is a great resource. Other than that, like I said, some of the cases that we get from the public, we are starting to share that with the county health department so that more investigations can be done and more postings can also occur to help prevent poisonings.
Yeah, so it's a great collaboration. You know, we've been for decades, we work with the state to share information related to pesticide exposures. And I think we also give them surveillance information related to the shellfish poisonings that Matt discussed. And now more recently, they're interested in harmful algal blooms because like Will said, this is something to pay attention to. Actually, I don't know if you followed this story, but this is a real tragic story about a family that was hiking up in Mariposa County. And they were near the South Fork of the Merced River. And then they were found mysteriously deceased the next day. There was a couple and their young child and also their dog, and all of them were found dead. This investigation is still ongoing, but one of the top culprits that they are looking for are harmful algae, some of which can be quite toxic. So like Will said, you know, unfortunately dogs pass away from algal blooms quite frequently because they actually drink a lot of water while they swim, unlike human beings. And so if that water is toxic with algae, then they're just exposed all the time when they're out swimming. So that's why you really see the signs. It says, you know, absolutely keep your pets out of the water and you should think twice about getting in there yourself. It's because this happens all the time. This investigation is still ongoing and it will continue to, I think, garner interest because it's such a sad and shocking story where, so, you know, all of them were found to be deceased the next day. Now, keep in mind that the temperature was very high that day. It was 108 degrees. So the heat probably played some role, but they're not sure if that was the only factor in this family's demise. And so it's another kind of ongoing story where, you know, the sheriff, the coroner, the CDC are all kind of partnering to help figure out exactly what happened. But that was, you know, I think another dimension to this algal bloom story is like, you know, these are things that we do need to keep track of because the algae, they did find toxic algae growing in the South Fork of the Merced River right next to this hiking trail. So whether that caused this death or not is still to be determined, but it's just a very interesting connection, a very concerning connection. Wow, that was great. What an enjoyable series of presentations and great comments in the chat. Hopefully everyone had a chance to follow along on the chat. We're recording this, so we will definitely archive this. This is just a fantastic presentation. And if you have any other questions, we shared some websites. We shared the poison control hotline number, and we're happy to answer any other questions that you might have about this topic or any suggestions about, you know, how we can all, like I said, collaborate together. You know, whether we call it C6 or something else, we do need to form a partnership and a collaboration related to these multiple dimensions of climate health that I think we are going to contend with. So I'll end there and we'll see you next week. In the meantime, be safe and rest and recharge and take care of yourselves. Thank you so much. Take care.